Hi. Hello. It's so great to be here with all of you. My name is Jessica Hausauer, I'm the CEO of the National Coalition for Hospice and Palliative Care. And today I'm going to share some updates around policy and advocacy. I'll start by sharing more about the coalition and the work that we do and some of the key initiatives that we work on. And then we'll talk about the political context and the policy context that we're living in and sort of what the coalition is doing relative to pediatric palliative care and hospice. So the coalition, our mission is to improve care for people with serious illness by aligning voices, expertise, and action across the fields of palliative care and hospice. And our vision is that all patients, families, and caregivers have access to equitable, high-quality palliative care and hospice across the lifespan. Our coalition is composed of 14 leading organizations that represent the interdisciplinary fields of palliative care and hospice and serious illness advocacy. So this slide here shows you the representation of our membership and our board of directors. And this slide here is going to tell you a little bit more about some of our major programs and initiatives. And two of the main initiatives that I want to highlight today are the clinical practice guidelines and the work of our pediatric division. So for those who are not familiar, the clinical practice guidelines are the clinical practice guidelines for quality palliative care, and they were established back in 2004 by the leading national organizations who said we really need some guidelines for palliative care. It was a new field. We need a roadmap and a blueprint for excellence on how to provide palliative care. And so over the last several decades, those guidelines have been updated periodically, and the most recent update was published in 2018. So we're in currently the 4th edition of those guidelines. And those guidelines have changed each time they were updated. They had enhancements and improvements. And in 2018, the focus of the guidelines was on community-based palliative care, so making sure that that was addressed throughout the guidelines, and also working to improve the pediatric representation throughout the guidelines as well. So they're getting a little out of date. We need to update those guidelines, and so that's a major piece of work that the coalition will be doing really for the next 18 months to 2 years, is working to produce the 5th edition of those guidelines. So we have a panel of experts from across the field. You have 33 members on that panel. And we're excited that this time we actually have 5 pediatric representatives on that panel, which is an increase over 1 from the last time we did it. So really looking forward to rolling up our sleeves and doing that work. And so stay tuned for the release and the dissemination of those guidelines. Again, those are really about the blueprint of excellence for palliative care. The other initiative that I'll highlight today is the work of our pediatric division. So back in 2019, national leaders in pediatric palliative care got together and said, what do we need to advance this work? What do we need to come together and elevate the work of our field? And they said, we need a task force. So they created a task force. And the coalition was identified as a good home for that task force. And so the coalition provided administrative support for a number of years. And in 2023, right as I started in my new role with the coalition, the board decided to shift that work from a task force, which is sort of a temporary idea, to a division within our coalition. So what that means is that pediatrics really has a permanent home within the coalition and dedicated program support, fundraising to advance the work. And that division is composed of pediatric experts from all of our member organizations, so those 14 organizations that you saw on the slide, as well as patient and family advocates, including Dinesh Shu, who's one of our members of the division. Yes, applause. And it also has membership on that division from representatives from the American Academy of Pediatrics, the American Psychological Association, and American Child Life. So we make sure that we have good partnerships with those pediatric-specific organizations as well. The coalition, you're a group, but you're part of lots of other groups. So another area where we're really involved is with the National Academy of Sciences, Engineering, and Medicine. their roundtable on quality care for people with a serious illness. The participating in the Patient Quality of Life Coalition, which is convened by the American Cancer Society Cancer Action Network, with an emphasis on advocating for PCHETA, which is a workforce legislation, and we're part of the Center for Excellence in Assisted Living. One of the big initiatives that we worked on over the last year was to say you've got all these organizations at the table. We're doing all this policy and advocacy work, but do we have a consensus-based agenda? What is that comprehensive public policy agenda that we can advance as the field of hospice and palliative care? And so we created a consensus policy agenda, sort of a broad policy agenda that attends to both adult and some pediatric issues. And I'm really excited to announce that we just finalized and will be releasing our pediatric specific national consensus policy agenda. So the goal with these agendas is to provide a roadmap for all of the organizations doing good work in this field to say, here are the things that we can advance. Here are the things that the coalition is going to advance. How can we amplify one another? How can we support one another? And who can do what? So that's really the goal of this agenda. And again, to show that there is a consensus around all of these issues that are on that agenda. I won't take the time to go through those today, but there are hyperlinks if you get the slides afterwards that you can see all of the recommendations that are part of that. All right, so let's talk a little bit about the public policy space that we're in. And I'm going to start at a high level in terms of thinking about the context, because we're in a challenging policy environment and that context really matters. And just to kind of start us high, we'll kind of funnel it down to be more narrow and specific. But if we look at the political, economic, social, and technological context, starting with the political, I think it's fair to say that we're in a fairly volatile climate right now. It's very uncertain. It's very complex. 2025 started off with some really major changes at the federal level in terms of the federal workforce was significantly depleted. We saw many changes within government agencies, some of them being closed, some of them being shifted. And we saw federal funding freezes and sort of off and on uncertainty around grant funding, around federal funding for various issues across the spectrum. So that created a lot of instability and a lot of challenges for organizations, researchers, folks trying to do work that was depending on federal funds. Then in July, we saw the passage of the Budget Reconciliation Act of 2025, otherwise known as the One Big Beautiful Bill. And of course, this bill, one of the sort of headlines of this bill is the impacts on social services, specifically Medicaid and SNAP, so food assistance programs. We're seeing $1 trillion in cuts over 10 years to Medicaid, $200 billion in cuts to food stamps over 10 years. And what's going to happen as a result of this bill is that a lot of that burden for figuring that out, how to implement the changes and how to make up for those funding losses are going to fall to the burden of the states. So this bill is a big deal. It's going to have a lot of impacts, and it's something that we'll be watching really closely. Another major issue that's in the landscape of health policy is waste, fraud, and abuse. So hospice has been in the news quite a bit lately in terms of hospice fraud. There have been major issues in the state of California. Just within the last 2 months, there have been several hearings on Capitol Hill where hospice has been spotlighted. There are investigations that have been opened. And so that creates a political context that's a little bit challenging to navigate in terms of other priorities that we might have or issues that we want to talk about. It's always kind of having to address this issue. So that's national. If we then look at our state has been experiencing a lot of unique challenges, right? It's been a rough go. Here in 2026 and 2025, we saw, the unprecedented political assassination of our Speaker Emerita and her husband. We saw the attempted assassination of one of our major champions, Senator John Hoffman and his wife. That was a very challenging, difficult thing that we're still working through as a state. And then we saw Operation Metro surge We have significant investigations going on into our Medicaid programs in fraud, and HCMC, where our pillar of emergency care in our state is on the verge of collapse. So that is a lot in terms of political context and health policy context. Was a lot to wade through. And it just makes things more complex in terms of the policy environment. Oh, and on top of that, it's an election year. So you have the midterm elections coming up. In terms of economics, just really quickly, we are facing an affordability crisis. Things are getting really hard for families. Healthcare costs is one of those major challenges that people are experiencing. We saw that healthcare insurance subsidies were not extended, which is going to have impacts on people's ability to get care, impact of tariffs, military operations, and general wealth inequality. Social changes, we see just over the last few decades, major shifts in family structure. We see more dual income households. We see more female-headed households. And why does this matter? It matters because of the caregiving crisis. The challenge of the ability for people to provide that unpaid caregiving is getting more and more difficult, and we know that many of our social and healthcare services depend on volunteers and unpaid caregiving. So this is something to pay attention to. And then last but not least, and of course this is not a comprehensive list, but we're living in the age of rapid advancements of telehealth and AI. And what is that going to mean for health policy and care delivery moving forward? So no shortage of major issues for us to digest and to put in terms of the context of the work that we do. When we drill down a little bit further and we say, well, what's the context here for pediatrics? We look, at the field of pediatrics as a specialty. We want to pay attention to what's going on with our children's hospitals, and we pay a lot of attention to Medicaid because of the role that Medicaid plays in paying for healthcare for children. And so again, when we go back to that 2025 Budget Reconciliation Act, we want to think about what are those implications going to be for pediatric palliative care. We don't know yet because so much of that bill has not quite been implemented, and the lawmakers are working through some of the challenging issues that will be presented to them as we speak and as we move forward. But some of the things to watch and to think about and to pay attention to. So some of the key statistics. We know that Medicaid covers 44% of children and youth with special health care needs, 37% of children with cancer, and we know, and I think it was Todd alluded to this earlier, that children with medical complexity represent only 6% of children enrolled in Medicaid, but account for 40% of Medicaid expenditures. So what are we going to watch with this bill and these looming Medicaid cuts? We're going to be really watching the impact on children's hospitals because 50% of children's hospital revenue is through Medicaid. If we see that revenue decline, we worry that we'll see cuts to services and that we might see reduced access to pediatric subspecialists. We worry about reduced access to home and community-based services, and we worry that children and families will become either uninsured or underinsured as a result of some of the changes within this bill. As I said, as it stands now, it'll be up to the states to respond and to figure out how to navigate these challenges. And what experts in policy sort of anticipate is that states will likely have to take actions that make it harder to get on or stay on Medicaid. We might see reduced access to programs and services, and we might see increased use of prior authorization. Those are just some of the ways that states might respond. And I would point you to this report that was funded by the Lucille Packard Foundation for Children's Health and done by Manat Health. They just did a really fantastic analysis of, it was before the bill actually passed, so they were making some predictions, but they do a really fantastic job of sort of showing what Medicaid, how it works and what can be impacted and what some of the possibilities might be. All right, so key trends in pediatric palliative care as the division, we said, okay, how are we going to deal with all of these issues? What's going on in this space? What we know in terms of trends are that our patient population is small compared to other groups, but it is growing. We're seeing more diversity of need and more complexity. We know that access to pediatric palliative care is greatest in our children's hospitals. It's variable in community settings, and it's really tough in rural areas, as Jody mentioned earlier. Notably, with pediatric issues, payer sources are mixed. It's a little bit more diverse than what we see on the adult side with hospice, but Medicaid and CHIP are the most common payer sources. And one of the real challenges in the pediatric space, and again, this is because so much of what we do is funded by Medicaid, is that we just see so much variation. We see so much variation from state to state when it comes to access and to different policies. And even within states, right, we see variation between urban settings and rural settings. Some of that is by design. That's part of one of the sort of benefits of Medicaid is that states can do different things. But then at a national level, it's really hard because we see so much variation from place to place. We know that we have pediatric specialist workforce shortages, that the folks who are doing the work are not always in the places that have some of the need, and we do see a lot of burnout in the space. And something that we're paying attention to, and we don't have good data to track this, but what we're hearing, what we're concerned about is that we're seeing reduced access to pediatric palliative care and hospice, particularly community-based settings. Potentially hearing that places that maybe used to have it aren't offering it anymore. And so we're just kind of trying to keep track of that and trying to gather information on that as best we can. So the division did a survey in 2025. We wanted to have a touch point and to see, what are the needs and barriers today as it relates to pediatric palliative care. So we did a survey. We had 246 respondents. Many of you in Minnesota responded, so thank you for that. But what we wanted to do is we wanted to get a sense of what are the barriers and what are some of the recommendations that people might come up with. And we had really good response. We had interdisciplinary representation. We actually had quite a lot of parents that responded to this survey. So we feel like we got some really good input. In terms of barriers, the things that we identified in terms of themes are that one is lack of awareness and education is a major barrier, and that's both on the provider and the patient family side. And I think, we heard a little bit of this earlier about people saying, I didn't know about you, or I wish I knew about you sooner. Workforce shortages, inadequate training, insurance and reimbursement challenges come up frequently, those geographic and policy-based differences that I mentioned. And then what are the needs? People say, we really need more advocacy. Again, I think something that we've heard today. We need standardization and integration of our services so that we know, what one model being provided in one place is going to be similar to what's being provided somewhere else. And then the need for home and community-based care. So that's what we heard in terms of barriers and needs. And we used that information to develop that national consensus pediatric policy agenda. And that agenda is organized according to 6 pillars. So we have access, payment, program integrity, education, training, and workforce, quality and equity, and research. And then within each of those pillars, there's a various number of recommendations. So that's the comprehensive agenda. What I would encourage folks to do in Minnesota, if you're interested in doing advocacy work, is review that agenda and figure out what are the things that you want to work on as a state. What are things that you might want to pick up and advance, and that the coalition and national partners could help support. But for our division, we said, all right, we have the comprehensive consensus-based agenda. What are our priorities as a division and as a coalition? So our number one priority is going to be on protecting and improving public and private coverage for pediatric palliative care and hospice, including concurrent care. We've heard a lot about needs relative to concurrent care, that it's great that it exists, but it can be hard to implement. It's hard because sometimes state agencies aren't aware of it, people don't know how to bill for it. So we're hearing a lot of implementation challenges, and that is potentially somewhere where we could help as a national coalition, is to figure out what are those specific challenges that you all as providers are having in your states, and what are some tools and resources that we might be able to provide to help ease those burdens of providing that care. And I would just emphasize here that, when we think about policy and advocacy, we often get excited about what's the new bill or what's the new policy that we can implement. Sometimes we don't need that. Sometimes the advocacy work is around implementation and how do we implement things better. And so I think that's a conversation that we're thinking through and having around concurrent care. Our second priority is around development of pediatric-specific evidence-based guidelines, standards, and quality and equity measures. And as I mentioned, this will show up in our current work around the 5th edition of the Clinical Practice Guidelines. But there's a question as to whether or not there should be a standalone pediatric guideline. And who would partner on that. Certainly you would want to have the American Academy of Pediatrics involved. That might be something for the future. So we want to work together to figure out what are those guidelines and standards that we can agree to. And then third, looking at education and training initiatives. So the coalition is not going to provide new initiatives or training, but we know that there's a lot out there that's really helpful and can be beneficial. So how can we promote those initiatives? And how can we support efforts to provide primary palliative care training within general education curricula? And how do we equip people who are more comfortable currently or more used to caring for adults? How do we equip them to be prepared to care for a child when the need does arise, even if it's, not that frequent? So those are the places that the coalition is going to be digging in and being really proactive in terms of our public policy agenda. And as I mentioned, we stand ready to support others all across the country who are doing other things that are part of that agenda that we can support. Before I move, I'm going to share just a little bit about some state advances, but I would say if you're looking for something that's a little more specific and actionable, I would say the main thing right now that we can, you could take action on today is PCHETA. So it's the Palliative Care Hospice Education and Training Act, and it's a piece of legislation that's really a workforce bill. It's designed to provide authorization for funding to do education, to raise awareness, and to do research within states. And so this is legislation that we've been advocating for about 10 years. And we got really close in 2019 to getting it through the committee process and getting it onto the floor for a vote. And unfortunately, the timing where we're supposed to get a hearing in the Senate Help Committee, we got cold, and then COVID happened, and it just didn't happen from there. So people have sort of felt frustrated, I think, over the years of like, oh, PCHETA, why can't we make this happen? But I think we need to remember that there was a contextual challenge that we faced, and that it typically takes about 7 years to pass major legislation like that. So we really do just got to keep at it. Currently, Senator Smith and Senator Klobuchar are on the bill, so that's great. But we need to work the House side. We want to make sure that our House reps will get it, and particularly Republicans, and we want to do work there. So if you are feeling really motivated, PCHETA is something that you could make a call or send a note to your legislators today to take action that would really help the field. Recent state advances, this is just a select list. I know there was lots of different things happening around the country, but a few things to highlight. As Jody mentioned, Hawaii did just recently, they had passed and now are implementing a palliative care benefit that includes pediatric coverage, and New Jersey just does something very similar. This really matters for us in Minnesota because, as Jody mentioned, the Minnesota Palliative Care Advisory Council has been working on a palliative care benefit for legislation for that for quite some time. And when these other states are successful, it makes it easier for us. So now instead of us going to the legislature and saying, hey, do you want to study this? We can say, actually, there's already other states that are doing it. Here's how they work. Here's what's worked. And so these advances in other states are important for us and for our ability to make the case for something similar in Minnesota, and to be able to learn from what's worked for them and what they maybe would have done differently. And then in Connecticut, they did some really good work with a work group within their legislature to do a study to figure out what are their key recommendations to advance pediatric palliative care. And they came up with two things that they said were priorities. They said, one, we need to create a statewide pathway for coverage to pediatric palliative care. and we need primary palliative care training for pediatric clinicians. And they evaluated all the different ways you could provide a statewide pathway to coverage, and they actually landed on a model that I haven't seen in other states. They want to do their own sort of independently funded benefit through their legislature. That was, a recommendation they put out in 2025. I'm not sure where that stands in terms of success, but they had a really great analysis and capture like all the things you need to think about. And then on the education side, they said, you know what we need in Connecticut? We need a center of excellence so that we can coordinate all of the education and training needs that are required across the state. And I thought that was a really nice idea and something to think about as a way to advance the work and create like a hub for the training needs. And then finally, Iowa was successful with the advocacy of Mason's Lighthouse, I believe it is, that they were able to establish a pediatric palliative care facility license. So those are just some examples of states that have been making advances. How can we work better together in Minnesota? I think we have all of the, well, not maybe all, but very core pieces of a puzzle that are doing good work in our vehicles that we can use, and I think we just need to coordinate. So we have the Pediatric Palliative Care Coalition of Minnesota. We have a Minnesota Network of Hospice and Palliative Care, Christina and Ara. We have the Minnesota Palliative Care Advisory Council, which was legislatively established in 2017. We are required to report to the legislature each year and to make recommendations. That's why we exist. And so if we have pediatric recommendations, we can make them through that council. We have Crescent Cove and Mary's expertise in policy and her experience at the Capitol. I think there's a lot that we can do. And of course, there are likely others, maybe in this room, who might be good partners as well. So I do see some sort of new committee or coalition or something potentially coming together here. And then I'll just end here with a list of just some select resources that I want to make sure people know about. That at the national level are things that we're looking at and pointing to. So again, NASM recently did a report on how to enhance NIH-funded pediatric research. There's a Trends in Pediatric Palliative Care monthly like a newsletter that posts together the most recent research in pediatric palliative care, which I think is just a really good resource and something to share. In terms of education, the Pediatric Palliative Care Coalition through Pennsylvania does a webinar series if you need CEUs or education. And then there's this REACH program. It's an ECHO program. It's designed to be flexible, to provide teleeducation, to prepare hospice nurses who typically care for adults on how to care for peds. And then the National Alliance for Care at Home has a really great concurrent care implementation toolkit. So if concurrent care needs are something that exists here, I think working through that toolkit is something where state leaders from across the country might be able to come together to learn from one another on how to better implement concurrent care. And then in terms of advocacy, our division is leading the way in terms of public policy agenda. And then the National Center for Pediatric Palliative Care Homes is certainly a good resource for Crescent Cove and for organizations similar to that. All right, so with that, time is up. Thank you all, and I look forward to chatting with you some more today.